Hello, good afternoon. This is Dr. Van Beest. I'm with the HEALTHWave Physicians Institute, and we are here today to discuss the Priapus shot, or the P shot. Many of you who are listening today or watching today would have read about this already on our website or perhaps at other locations, but we're going to discuss it in some detail today. So the P shot uses what is known as platelet-rich plasma, so PRP. Now we know that blood contains plasma. It contains red cells, white cells, and platelets. But in this case, the platelets are vital in the blood clotting process. But it is these same platelets that also contain hundreds of proteins called growth factors, which are important in the healing process. And it is this healing process that we're going to make use of by using the P shot for men who suffer from erectile dysfunction, suffer from Peyronie's disease, and other factors such as these that we will discuss today. So PRP is plasma, but it has many more platelets that are typically found just in blood or blood alone. And the concentration of these platelets and these growth factors can be 5 times, if not far greater or richer than regular blood. And it is going to be this concentration of platelets, this concentration of growth factors that we are going to rely upon in this healing process that takes place. What is the Priapus shot? Named for the Roman god of virility, the P shot itself, while it has an interesting name, is no myth. It is a modern medical procedure that can help those men who suffer from erectile dysfunction. And it developed as a procedure to improve sexual health and function in men who had poor blood flow to the penis, which was caused by a number of different factors. Most commonly, we saw patients that had diabetes, those who suffered from high blood pressure, those with high cholesterol, those who were aging, those who had prostate cancer or suffered from the side effects of surgery or medication. And the P shot was intended to deliver lasting results, but with minimal discomfort, and represented a real medical innovation for male sexual enrichment. So how does the P shot work? It incorporates the harvesting and injection of your own platelet-rich plasma, your own PRP, which rather, once harvested, is injected into specific areas of your penis. And the P shot itself uses blood-derived growth factors to revitalize penile tissue. And at the end of the day, that is what we're going to go after. We want to rejuvenate the penile tissue. We want to increase blood flow to the penis, and in so doing, help those men who do have erectile dysfunction issues. But the injection of PRP itself is the injection of your own platelet-rich plasma. This is therefore a natural process and has no risk of rejection, and that is important as well. In terms of how much blood we would need, the same amount in this case as you would have or you would give using a simple blood test. We then place it in a centrifuge, which then would separate the stem cells and the growth factors from the red and white blood cells, and what is left is going to be the super concentrated platelet-rich plasma that forms the basis of the P shot. And it is this PRP that provides the healing power of those growth factors and stem cells to enhance or begin to improve, begin to regenerate, begin to rejuvenate all aspects of sexual health and function. So, are you experiencing these issues? If so, the P shot may be part of the solution. Do you suffer from decreased sensation and decreased pleasure? Are you experiencing an inability to achieve or maintain a full erection? Obesity and diabetes form an important role over here, but you know too that high blood pressure, that high cholesterol, and certain medications which have side effects have a significant role in erectile dysfunction as well. Typically, associated with aging, we will see a decrease in size. That is, not only a decrease in girth, but potentially also a decrease in length. The reason why the next bullet point is actually highlighted is because Peyronie's disease, which is a curvature of the penis that causes pain or causes an inability to have sex, is going to be an important part of this equation as well. Those men that have prostate issues too may see a solution in the P shot itself as well. Who is a good candidate for the P shot? Those men with mild to moderate erectile dysfunction. We know this affects up to 10% of men per decade of life. So if you think about that, say we assume that 10% of men are affected at the age of 50, 10% more by the age of 60, 10% more by the age of 70. This is an ever expanding field, unfortunately, and about 5% of men 40 years or older have complete erectile dysfunction, but at the age of 70, that number actually increases to 15%. I personally believe that that number is actually a little bit higher, especially in this day and time, what with the foods that we eat, what with the stresses that we are under in our daily lives. We also know that older men are more likely to have health conditions which require medications, but it is sometimes the case that those medications are the very cause of erectile dysfunction. The next bullet point that you can see for the good candidate for those who could use it are those that suffer from Peyronie's disease. And at the end of the day, the P-shot is going to be a treatment option for men looking to improve sexual health and overall function. So take that or be that as it may, but take it as you will, so to speak. It is not only for those men that do suffer from erectile dysfunction, but also for those men who are seeking to improve their sexual performance in the bedroom. I told you beforehand we were going to come back to this Peyronie's disease issue because that's part of this whole equation here today. Peyronie's disease, which is going to be a curvature of the penis, is a poorly understood penile disformity, and it mostly occurs in men 50 to 60 years of age. It can obviously occur when we're younger, but this is typically when it begins to show up. The condition includes a curvature of the penis or a plaque formation in the penis, but this is normally seen with penile pain and over time the development of erectile dysfunction. For those who have Peyronie's, there may be a deformity that is only evident during erection, and sometimes an hourglass defect exists, so therefore the penis looks as though it has an hourglass shape in it, or has it in one segment, wherein the penis is actually going to be narrower. From that point of that hourglass forward, the strength of the erection is affected by a decrease in blood supply to the end of the penis. But otherwise, a nodule or a plaque could be felt in the penis and may contribute to the curvature. And over time, that plaque may accumulate calcium and therefore become a harder nodule, a harder plaque. So continuing as to what Peyronie's disease is, pain is often going to be the first sign, and it will frequently occur before any noticeable bending is seen, and the bending will normally occur to the side of the plaque. So therefore, where the plaque to occur on the left side of the penis will tend to bend to the left. On the right, the penis will bend to the right. But in most cases, the pain will actually resolve over time, but the plaque formation and the curvature persists. And it is with platelet-rich plasma that the goal is to begin to cause this plaque to break down and to reduce this curvature. About 50% of the men who present with Peyronie's disease also experience erectile dysfunction. I spoke about that earlier. That is at that point where there is that plaque, at that point where there may be that hourglass presentation. There is going to be a decrease in blood flow beyond that point, and that obviously is that erectile dysfunction. That is a softening of that erection. Now, the process by which Peyronie's disease develops is frequently unknown, but the leading idea or theory is that trauma, which is often unnoticed, of penile buckling is the cause of this. This normally obviously would occur during sex, but that is the leading theory as to the cause of Peyronie's disease. In terms of processes not including platelet-rich plasma, surgical procedures are routine with the intent to straighten the penis, to excise, to cut out the plaque. And at the end of the day, because the penis is so much an organ of blood, may involve a penile implant. Staying on the Peyronie's disease, published research has demonstrated improvement in the erectile function, size, and correction of Peyronie's disease with the use of platelet-rich plasma when injected into the plaque itself and also into the area around the penis. As you can imagine, a rejuvenation of the tissue takes place, and there is an increase in oxygenation to the penis itself. As that occurs, the plaque will begin to soften on the one hand, or where there is calcium within the plaque, that dissolving of that calcium within the plaque takes place. Studies have indicated an improvement in the health, the circulation, the strength of penile tissues with the injection of blood-derived growth factors into the penis, and the use of an injection of platelet-rich plasma has demonstrated improvement in the angle of the penis in men suffering from Peyronie's disease. So, for what it's worth, a dramatic improvement or a dramatic alternative to surgery. Overall, platelet-rich plasma has its benefits, and these will include the ability to enjoy sexual relations even the day of your procedure. Over time, there is an increase in sensitivity. We all know that confidence in men is vital in the bedroom, and what with an increase in girth and potentially length, there is going to be an increase in confidence. What with platelet-rich plasma, there is a more rapid onset of results and a better, healthier sex life, which we all know will result in improved intimate relationships. This, though, is a 30-minute procedure. It has minimal discomfort and has the potential of significant positive effects. The results. Many men will experience improved girth with the P-shot almost immediately following the procedure. Over time, especially after 3 weeks, there will be an overall increase in health and function of the penis that actually occurs. And this growth of new tissue will continue for at least 12 weeks thereafter. Please understand another factor. Before the P-shot is undertaken, we will also use a shockwave therapy on the penis. This is to begin the process of healing, to improve blood flow to the penis, and with the use of platelet-rich plasma, allow this process to be even more effective. So, A simple but good question. If it is assumed that we as men or as women are physical creatures, that we are mental creatures, that we are social creatures, that we are sexual creatures, each one of those subsections is vital to our existence. Each one of those is vital to our full enjoyment of life. I think that's an important question, or an important point. So the question is here in this case, are you ready for tonight? Because there's a very good chance that she is, and the prior shot may be what is needed. Schedule your appointment today, but if you wish to speak to me, please do. You can contact a team member at 817-701-0700. But if you go back to the website, you can complete the appointment form on our website. And I do look forward to speaking with you should you have any specific questions for me. I want to thank you for participating in this webinar today, or watching it at least. And I look forward to meeting you. Thank you.